Okay, so with anemia, the big thing is they alternate periods of rest with activity. They get really tired. Okay, now thrombocytopenia is due to decreased platelet levels. Okay, so you want to monitor for that and monitor for petechiae, ecchymosis, which are bruises, bleeding gums, and nosebleeds. So keeping
So
again, what's
petechiae is like red. The petechiae is like red spots on
yes,
the
it's like
skin.
a rash. It looks like it
Yeah,
can look like a rash.
yeah.
Yeah, and with bleeding gums, you want to keep the mouth moist and the lips moist with you want to use like water soluble lubricant on their lips, okay, so that they don't like crack and they start bleeding. Don't
Okay.
overinflate blood pressure cuffs because they can get really bruised, okay? Use a lift sheet when you're turning and repositioning the patient because they can just start bleeding. So you want to make sure you're not, moving them around too roughly. And then minimize needle sticks, injections, nothing per rectum. Don't give any suppositories. Don't take a temperature rectally. Test all urine and stool for the presence of blood, and then apply ice to injured areas. You want to make sure your patient is on a stool softener. Don't give anything per rectum. The reason you have make sure they're on a stool softener is you don't want them to get constipated because if they try to pass hard stool, they may start bleeding from the rectum. Okay.
Yes.
Um, Remove any tripping hazards. Make sure your patients are using soft toothbrushes. Okay, they have good fit with their dentures because that could cause bleeding in their mouth. And instruct them not to blow their nose rigorously. They need to have, or they need to use an electric razor. Okay, alopecia, this is a side effect of chemotherapy. Okay,
But I hear
stomatitis.
some type of chemotherapy is like you won't lose your hair, right?
That's true. There's only some of them, but you're going to be tested more broadly. Like chemotherapy can cause, stomatitis, mucositis, alopecia, bone marrow suppression with the neutropenia and thrombocytopenia. You're not going to be asked like, which
Yeah.
chemotherapy does what. Yeah.
Okay.
All right. So stomatitis and mucositis. This is irritation in the mouth. Okay. So check the mouth frequently. When I worked in oncology, we had patients that were on medication that we had to check with a flashlight inside their mouth every shift, every couple hours. Okay. Make sure they're being provided with good oral hygiene before and after meals. Use soft toothbrush. Never use alcohol based mouthwash. Make sure you're irrigating the mouth before eating or irrigating the mouth after to counteract that acidity in the mouth. Okay. Make sure they don't eat hot or very cold food, hot food especially. Okay. You want to increase the fluid intake. All right. Avoid hot and spicy, salty foods, any alcohol and tobacco. So bland food. That's what you want to do. That's important. For nausea and vomiting and anorexia, mouth care before eating. Also, drinking a carbonated drink an hour before eating may help. Um, don't wear heavy scents. Like when I worked in oncology, we couldn't wear any perfume or like smelling lotions or anything like that because patients would like really get sick.
Yeah.
And encourage small, frequent meals. There are other chemo effects like neuropathy. You're going to learn about that in pharmacology. Okay, radiation. This is super important. You have to differentiate between brachytherapy. The word brachy means short. Okay, short therapy, and teletherapy, which is tele means long. Okay, so
Yes.
brachytherapy means the radiation is inside the patient's body. So it's internal. It's an implant or it's something they had to drink or they had IV. So with brachytherapy, the internal radiation, the patient is going to be radioactive. Okay, so there's a lot of nursing implications. We're going to talk about that. With teletherapy, the patient is getting the radiation long term, and it's external. So they go for treatment, they get their radiation, they're not radioactive. Okay, it's only brachytherapy that makes people radioactive.
Oh, okay.
Okay, so that's important to know. Okay, brachytherapy. This is what you need to know. All the waste products in the patient's body are radioactive. So wherever you work, they'll have a policy how to dispose the urine and stool. Okay, make sure your
Yeah,
patient's in a private room.
like wear a double gloves gown, right? If we,
Yes, you keep everything in the room. You never take anything out of the room while the patient's there. Okay, place a sign on the door, warning of radiation. You're going to wear something called the dosimeter, and this measures the radiation you're getting. Okay, so the nurse wears that. Maintain 6 feet whenever possible. You want to stay 6 feet away from the patient, and you never want to be in that room more than 30 minutes a day or 30 minutes a shift. Okay. Nobody pregnant or trying to become pregnant or trying to get somebody pregnant and children under 16 cannot go in the room. Okay. If an implant becomes dislodged, pick it up with forceps and place it in a lead container. When you wear a lead apron in the room, don't turn away. Don't turn your back on the patient, okay? Because the back is open. That's why I'm saying that. With teletherapy, you have to make sure the skin is marked. The skin will be marked with tattoos. Do not remove them. Tell the patient not to remove them. Manage fatigue. They can have injury to the skin from radiation, okay? So again, the patient undergoing teletherapy is not radioactive. So with teletherapy, depending on where they've had it, okay, on the body, they could have mucososis, just like we just talked about. So, and they could have also, instruct them to avoid hot, spicy foods because their mouth may really hurt when they eat. Okay, you never want to lose lotion, harsh soap, powder, ointment, or perfumes on the skin that is getting radiation. They cannot use washcloths. They cannot wear tight clothes. They have to wear soft clothing. So students always get these teletherapy and brachytherapy mixed up. So make sure you don't get them mixed up.
okay.
Okay. So the main